You know, we had set this press conference up and had a list of speakers, and while we were together preparing for that lineup and what we would say, we received news that there were some cases identified in Cuyahoga County. And so, of course, that has changed the whole press conference from what we were going to do. But I do want you to understand that as Terry Allen comes forward, who's commissioner of the county health department, that we are prepared. Not only are we prepared, we are ready, and that if you have any questions around that preparedness or that readiness, we have people here who can answer those questions. But to update you on what has currently happened, then Commissioner Allen from the County Health Department will speak.
Thank you, Mayor Jackson, and thank you, County Executive Armin Budish. We've just learned that 3 persons under investigation for COVID-19 have become 3 confirmed cases based on testing that was completed at the Ohio Department of Health. The age range of the cases is 54 to 56, 2 males and 1 female. They are residents of Cuyahoga County and live outside of the city of Cleveland. All are currently quarantined at home. Following CDC guidelines, a total of 6 close contacts are quarantined at home as well. The health department will be conducting contact tracing of individuals who came in close contact with these patients. There are 0 hospitalizations at this time. These cases have all had travel history outside of the state of Ohio. 2 were on a trip in Egypt. 1 was at a conference in Washington, D.C. Working as we have in every emergency to date, we've combined city, county together in an emergency operations center that's open to respond to the COVID-19 situation. The process we've put in place for both public health and hospitals has worked in the past as we work together to address this evolving situation. People shouldn't be nervous. People should be ready. People should get educated. There's lots of information out there about how to deal with COVID-19 and to protect yourself, your family, your coworkers. If you have immediate questions, the State Health Department has established a hotline. The number is 1-833, the number 4, Ask Ohio. I'll repeat it again. The number is, I need to fix that, 1-833-4, Ask ODH. 1-833-4, Ask ODH. Now I'm going to hand the mic over to EMS that will speak to the protocols of transporting to the hospital should these individuals experience symptoms or get sick.
Good afternoon. I'm Commander Christopher Chapin from Cleveland EMS. We do have protocols in place to transport these patients. They are in place to protect the safety of the crew and to ensure that all people involved are treated appropriately and that the sick are treated and transported appropriately to the appropriate facility. We do have special respiratory protection for our providers. They have all been trained, retrained. Again, they are all brand new devices. They exceed what is recommended for this crisis. And that is all. We are ready and we will be prepared if anything happens. Thank you.
Any questions? Yes, I can't hear you.
How long ago was it identified that those 3 individuals were identified in Cuyahoga?
I don't have the specific dates for these individuals. We do know that as soon as we were aware of them, they were immediately home quarantined. And as symptoms develop for those that had close contacts, they will be monitored for if symptoms arise. So this is what public health does in these circumstances. We first identify where there may be cases of concern. We then diagnose. we diagnose. And if we have positive cases, we then isolate people who are sick or quarantine those that aren't sick that may have come in contact with the case. And then we contact trace. That means we identify people that had close contact, 6 feet, coughing very close with these individuals that may be at risk so that they can be self-quarantined. This is what we use for measles. This is what they do for TB. This is a standard shoe leather public health response, and that's how we're handling this as well.
Several big events that are coming up that people will be in very close contact. Has there been any decisions on the status of those?
No decision on large events yet. We're going to do this day by day, and we will do whatever is recommended to us by the CDC based on whatever facts come forward. And if necessary, we will cancel. But as of right now, there is no cancellation.
Hey, Jackson.
Yes.
The gentleman from EMS mentioned that there's new safety gear.
Yes.
Can you speak to how many they have? Do they have enough for all the first responders, or is there a limited amount? Do they have enough to go around for everybody?
Well, the quick answer, I think, is yes. Go ahead. They have it on the vehicle.
They have it on every vehicle?
We have it on every vehicle for EMS providers. Fire and police, they have their own PPE. But what I was speaking directly to, we have on our trucks for EMS providers, and we actually have a few extras. But what I was speaking to is for us. We are assisting police and fire, and if they need any. But as of right now, it looks like everything is under control.
What kind of contact could those people who tested positive had with the greater community outside the 6 close contacts who are already quarantined?
When we found out about these individuals of concern, they're advised to self-quarantine as soon as we made aware. We then talked to them about close contacts. Where have they been within some distance of people where there may have been risk? So we've identified these 6 folks that are now currently home quarantined because they have identified that close contact of concern. So we're going to watch them and see if they have symptoms to make a determination on whether we need to test them going forward. If they don't have symptoms and they're fine, at the end of that 14-day quarantine period, they'll be able to go about their lives. So our job is to sort of listen in, stay in contact with the cases, and if any other people of concern develop, we will follow the same process of identifying, diagnosing, the other piece around contact tracing and isolation and quarantine. Those pieces are all together. So we'll follow that same procedure.
Do we know what kind of public places they were in addition to that contact with those 6 people who are also quarantined?
Well, we would have walked through them individually and determined if they were in public places, whether they had any contacts that would warrant concern in terms of exposure. Remember, these folks all got exposed outside of the state of Ohio. In fact, the exposures are, at a conference and then in Egypt. So what it tells us is that we're not dealing with a situation where they got exposed here locally. So people need to understand that. We know that this is where public health kicks in so that we can try to prevent spread here in greater Cleveland, and that's what we've been doing.
As a follow-up to that, then, what's the chance that somebody in Cleveland who isn't doing this kind of traveling gets exposed or becomes a positive test for the coronavirus?
Well, we think right now, overall, we're seeing the concern about COVID-19 across the United States. We think overall there are things that people can do to limit their risk. This is brand new. It's a new virus. It's never actually resided in a human, right? So we're not sure exactly how it will behave. We're learning in real time. We know it transmits. For every person that may get sick, maybe 2 or 3 people could. A little bit more than flu, right? So we're aware of that. We can understand those components. So we want people to do the first thing that public health tells them to do, right? We tell them to wash their hands. 20 seconds, soap and water. Exactly. Wash your hands. Stay home if you're sick. We want to make sure that you're cleaning surfaces thoroughly, door handles, cleaning shared computer terminals at work. Stay home when you're sick. Perhaps opportunities for people to consider as we go forward if this expands to work remotely. Look at telework opportunities. So there's a few other pieces that I think are critical. Who's most at risk? Who's most at risk? We're talking about seniors. We're talking about people with chronic illnesses like heart disease or diabetes. We're talking about people with reduced lung function. We're talking about people that may have immune suppression because they're on cancer treatment. These are the folks that we're concerned about. We aren't seeing a lot of kids. We aren't seeing a lot of kids. So it's important to know that 80% of folks, based on a large data set from China, the indication is that their symptoms will be mild. So that's based on a large data set. We want to concentrate on our most at-risk folks. We also want to make sure that people aren't buying personal protective equipment on the internet. It needs to be saved for our first responders, EMS, and for our hospital personnel so that they can protect themselves because they're caring for individuals that may be ill.
In that same vein, sir, quick question for you. On a national level, they've been talking about the inability of the government to test as many people as need to be tested. Possibly, how is that playing out here in Cuyahoga County or in the state of Ohio?
Right.
If someone wants a test, can they get a test, and how soon can they get it?
Right. Right. So what we know right now is over the weekend, it was announced by the Ohio Department of Health that they have a new testing protocol. So let me talk a little bit about that protocol. The state health department currently has the capacity to test 300 or 400 people. Additionally, we now know that there are a couple companies across the country that are putting out private tests that can do much more testing around the entire country through clinical settings, through hospitals, et cetera, primary care practices. They can do testing in those situations that will greatly expand the testing capacity. Those that are most sick, those that have exposure to somebody who may have COVID-19, those that may have been exposed to somebody who traveled to one of the countries of concern, they are going to be tested. If they're sick, they're going to be tested first, and they would be funneled to the state health department. Those that aren't quite as ill, but are of concern based on other indications in the protocol that the state has recently released, what will happen is that then they'll get tested through these private companies through their clinical provider. We don't think people should be flooding in asking for testing because they're worried. We want to make sure the tests that are available right now are available for those that are at risk. That's very important.
Are any of those 6 quarantined?
Excuse me, ma'am, go ahead.
The 6 people quarantined, are they all connected to the 3?
The 6 people are associated with these 3, yes.
People all know each other?
No,
2 in Egypt, 1.
that's correct.
Were they all 3 in the same town outside of Cuyahoga County? Or within Cuyahoga County?
I don't believe so, but I don't have that for a fact. They're outside of the city of Cleveland. I don't have the exact locations at this time.
Are they children?
Wait, excuse me, sir, go ahead.
I want to clarify the timeline. This state revealed today that they've got 3 positive. So what you're describing, it sounds like you've been in contact with these people previously.
Yeah.
This was the confirmation versus
Right, sir, that's correct. So we have been tracking, now the number is probably approaching 260 people across the state, working hand in hand with the state health department and the CDC. Travelers come back from areas of concern. Maybe it's Italy, maybe it's China, for instance. So they're coming back from areas of concern. Immediately we are made aware of this, work with the state health department, and those folks will self-quarantine at home, and they'll monitor for symptoms. Remember, quarantine is for healthy people that may be exposed, and isolation is for people that are sick, so they don't expose. So that's been happening right along since the emergency declaration that happened at the beginning of the month. So we continue to monitor people as they emerge and as they come back from travel. And the idea here is that we are trying to contain this. We're in a containment mode by having them stay home, relax, watch some Netflix, let some time pass, and watch for symptoms. We're able to prevent spread in the community. As I said, this is done with tuberculosis, it's done with measles. These are standard public health protocols. Yes, ma'am.
The people in isolation, how are they being treated by health?
So they are in contact with their healthcare providers as need be. Right now, they're in a position where they can stay home and isolate, and so that's a good thing. But of course, they will continue to stay in touch with their healthcare providers as necessary.
Just a point of clarification on the testing. You said that there's some commercial labs.
Yes, ma'am.
Did you say those are online right now?
So there are some that are standing up now. There are actually 2 labs that I'm aware of. There may be others that our clinical partners can share. One is called LabCorp and one is called Quest. And so some are in the process of either standing up or will stand up soon, those capacities.
That is in Ohio?
Yes, as well as other places around the country. Ma'am, you had a question back here.
Question of the 3 that tested positive, they all come in through they were out of town. The other question about the
Yeah, I don't have that information at this time. I don't have that information at this time.
Just to confirm, the 6 who are being quarantined, they're not children. Do we know an age range for that?
I do not.
Okay, but definitely not.
I don't know the age range.
Sir, can you give us your name again?
My name is Terry Allen. I'm the health commissioner at the Cuyahoga County Board of Health. So this is a fluid situation, and we're going to keep you updated as we go forward. These are the first cases in Ohio, here in Cuyahoga County, and we learned about them as you're learning about them. And so, just a last piece. I'm sorry, Ginger. Last piece is that we can anticipate more cases in the state of Ohio. Testing is ramping up, and as we seek, we will find cases in Ohio. What we're going to be doing, as we have since post 9/11 with anthrax, with smallpox, with H1N1 flu in 2009 and 2010, with Ebola, together, city, county, hospital systems, safety forces, we're going to respond together. We're going to work together. We're going to make sure the public has the best information available to them to assure that we move in response to this in unison, and that works. I've been doing this for 30 years, and that works.
I was just going to ask, how are you going to communicate information to the public?
Well, we'll be communicating together through the Joint Information Center that is part of the Emergency Operations Center that is being established at the county.
There's a fair amount of disinformation, some have said, in regards to when this will peak and how it will peak.
Yes, sir.
If it gets warmer, is it going to go away?
So I would say right now, I'll repeat something I said earlier, is this is a brand new virus in terms of human exposure. It's in animals, it's been found in bats in China. We've all read that and heard that in the newspapers. So now it's in a human host. So we're not sure how it's going to behave. We don't know if the weather changes, if it will diminish. Only time will tell. Our job is to understand that this is not a sprint, that this is a marathon, and we're treating it as such.
Yes, my question is about hospitals. There's been some reporting nationally that if we have a lot of people getting sick, there might not be enough respirators in the
Yes.
hospitals to handle those folks. How many respirators do we have here in Cuyahoga County? And do we anticipate we have enough if we have large numbers of people need assistance?
Anybody want to speak specifically to that? Brian, you want to? Brian Lane, the Executive Director of the Center for Health Affairs, is going to address this question.
I appreciate the question. The hospitals have enough specialized equipment right now to take care of the patients, and we're keeping the state health department informed about supplies of specialized equipment like masks, gowns, and gloves. The Ohio Department of Health is direct communication with the CDC about the equipment and supplies, and the federal government is currently working with all manufacturers to get more of it in the hands of all the different healthcare providers.
My question is more about, that's great to know that. My question is more about the people who get sick. Do we have enough respirators if a lot of people are all sick at one time? Not about the workers themselves, but about the folks who are sick.
You're talking like from a family and patient perspective out in the field?
If a person is sick, they need hospital care,
Oh.
and they need to be on a respirator in the ICU to try to recover. Do we have enough capacity here in Cuyahoga County to handle
Yeah.
a large number of people?
We do.
What is that capacity?
I don't have that number for you specifically.
Quick question for you. Who enforces the self-quarantine? Those who are being quarantining themselves, who enforces that to make sure they don't get house fever and they go out?
Over the last, essentially over a month now, since this all began at the beginning of February when the travel changes occurred, we've been working in close contact. Health departments across the entire country, the Cleveland Department of Public Health, the Cuyahoga County Board of Health, we've been in contact with travelers, stay in touch with them during their quarantine period. People have been very supporting and willing to quarantine. They don't want to expose other people, their family members, and the like. And so we've had good cooperation for quarantine to date, and I think people understand the importance of trying to be part of the solution in addressing this situation.
What is the plan for the election next Tuesday? Primary folks going to polls and trying to get out.
I'm aware that their efforts have been made to step up cleaning, hand sanitizer, and the like at the Board of Elections to address that. We certainly want people to vote. Beyond that, I don't know if there's any additional information, but I know that that's already taken place to take some precautions. Do we want to wrap it up? you want to wrap up?
You got one more? One more? Yes.
Yes, sir.
Come on up. Come on.
In terms of the decision whether to cancel or continue major events, whose call is that ultimately going to be? Is that your call, or is that going to be at the
Well, that's a call based on facts and information and intelligence. So it'll be a group of people. Ultimately, I guess I will say yes or no, but it will not just be because I want to do it. It will be based on some facts and some evidence of something that requires us to do that. Okay? Well, I thank you very much.